And here we are outside the GSR hospital. This is the building itself. It's on 4 floors, ground floor, first floor, second floor and third floor, with an area at the top additionally. This is the forecourt, and here on our left we have a covered area which the patients and their parents pre-operation can use. It gives them shelter, they can wash their clothes, there's facilities there to do basic cooking, and if we move just slightly along you'll see that we have toilets and facilities for the patients and their families, patients pre-operative and their families whilst they're staying here. Children usually stay here for approximately 3 days, depending on the severity of the surgery required. And here we have some of the parents sitting waiting outside the hospital. Their children may be being operated on at the moment, and they're waiting here patiently in the shade. To enter into the main door of the hospital, into what is called the waiting area. This is where patients and their parents come and wait for either consultation appointments or to have their children registered for surgery. It's Monday morning, so it's always quite busy on a Monday morning, and this is quite typical. Lots of people waiting to be seen by the doctors or to the reception area where all the administration is done. On my left we have Dr. Raj's consulting room, and on the right we have Dr. Gosler Reddy's consulting room. And just behind us on the wall here you'll see there are some photographs on the wall, and these are photographs of some of the very many children who've been operated on here at the GSR hospital. And this consists of one large room and a small room beyond where the patients are seen. There are no patients there at the moment, but that is where they are normally seen. To a reception area of the main hall where some of the computer work is done, and just off there is a very small room where all the photography is done. As each child is admitted into the hospital, lots of photographs are taken before, so that a comparison can be done with photographs taken after the surgery. And we're in luck, someone's here having a photograph taken at the moment. And if we could just have a photograph of this is it a girl or a boy? A boy, this little boy. There we go.
So this boy is a hemifacial microsome.
Yes, I thought so.
And it's a type 1.
We saw him last week.
Last time. So my goal is to do a maxillomandibular distraction. I'm planning to do a maxillary leaf 1 osteotomy, and then I'm going to do a mandibular ramal osteotomy and use this multivectoral distractors other day which I showed you. And then goal is to increase the ramal height by 4 millimeters and inferior movement by 4 millimeters anterior, 3 millimeters, and laterally by 4 millimeters of rotation. At the same time, because I do even maxillary leaf 1 which I'm going to do an IMO, even the maxilla also, the can gets corrected by another 4 millimeters at the same time on that side.
Walked up the stairway onto the first floor, and here we have some of the private wards. The GSR hospital runs on a system of providing free surgery for any child or family that cannot afford the care that they require. However, Dr. Raj and Dr. Gosler do perform some private surgery, and this money from the surgery goes towards paying for the upkeep of the hospital and providing free surgery for those who can't afford it. So we're now on into another area which contains the pharmacy. And here we have the pharmacy for the hospital. And this is supervised and run by one of the speech therapists. And just to our right, we have a washroom. Second floor. The second floor contains the 2 operating theatres and the intensive care unit where all the patients go for a short period of time after the surgery has been completed.
Intensive care. It's adjacent to the operating theatres, which are just round here. It's 6 beds. Most of the patients are out within 4 hours, and if they're not, then they are kept longer as required. With Professor Gosler scrubbing up for his next patient, which is what are you doing, Gosler? Unilateral complete cleft lip and palate. No, just the lip. On how old?
4-month-old.
On a 4-month-old baby. Okay.
Here we have the nurses' lounge. There are approximately 10 nurses employed by the GSR hospital, and as you would expect, there are always nurses on duty 24 hours a day. Likewise with the medical staff, there's always an on-duty doctor available 24 hours a day. On the 3rd and top floor of the hospital, this is the general ward, and this is where all the patients, a large proportion of whom are the children, go after they're signed off from the intensive care unit, and they stay here for approximately 2 to 3 days following their surgery, depending on how quickly and well they recover. And we're looking here at a little girl who seems to have recovered very well from her surgery and is enjoying life and crawling around. There are 32 beds in this general ward, so whilst it's not full at the moment, there is a capacity for 32 children or adult patients. Conditioning, but an enormous number of fans, and although it's a pretty hot day today, it's quite cool in here and certainly bearable and reasonably pleasant. And here again we have the little boy who's in awaiting surgery for his unilateral cleft lip and palate. And he's too succumbed to the heat, so he's having a nap before surgery, which might even be taking place later on today, or if not, maybe tomorrow. But I think it's scheduled for later on today. And here we're standing right at the top of the building again, and just to give you an idea of the area that the hospital is in, we're now looking around at the surrounding houses, flats and businesses. As I say, we're right in the heart of the city of Hyderabad. Focusing in on the brown and cream coloured tall building, which is where 71 children from the Cleft school project live as their home during term time. We're now inside the building and we're just walking into the big ground floor area, which is the communal area where the children play on a Sunday, do their homework during the week, and generally congregate. If we look over here, we see there's a lift. The lift operates to take food and heavy items up to the top floor where the children have a dining room and where they have all their meals when they're in the project. Just over here, we see all their shoes neatly laid out in little cubicles. Around, and there are the children all sitting very quietly, very quietly. It's Sunday today, so they're not at school, and they're all wearing their Cleft project uniform. The girls wear pink and the boys wear green, and they're all looking very smart today. See in the corner there's a cabinet, and it's a very small cabinet, and that houses the children's library. There are a few books in there for the children to read and to learn. Most of them are in English, but some are in Telugu, their native tongue. The children follow a strict regime of yoga and exercise yoga every morning between 5 and 6 o'clock, Monday to Saturday. They seem to enjoy it, they're very skilled at what they do. They take a lot of pleasure in keeping supple and keeping their minds and bodies in trim. going to demonstrate the yoga? Who's going to demonstrate the yoga?
Vrishikasana.
Wow, look at that. I think that's quite extraordinary. How fantastic. Well done. The first flight of stairs, and we're on the boys' dormitory floor. This is boys' dormitory number 1, and here we have boys' dormitory number 2. And we're just going to go and have a look inside boys' dormitory number 2. And here you will see the children sleep on bunk beds. Gosh, it's tidy today. They have fans. There's no air conditioning, but they do have fans. It's a very hot day today. We're the 22nd of February, which is summer coming in India, in Hyderabad. So it's pretty hot, but actually it's very nice and cool in here. Each child has its own bed. They have a sheet, they have their own towels. And as you'll see, between the 2 beds, there's a wardrobe in which they can keep their personal belongings. If we just move over to here, you'll see that each child has its own plate and its mug, and they're all kept neatly here, and these are their water bottles. We can also see their school bags. The school bags are provided by the project, and obviously we're just about to enter the floor with a girls' dormitory and a boys' dormitory. So let's go into the girls' dormitory, which again looks very tidy. And here, this is quite a large room. In the corner are all their plates and cups. As I said before, each child has its own plate and cup, which they take up to the top floor when it's time for them to eat their meals. Extraordinary area. It's basically we're on the roof. And here is where the 3 cooks prepare all the meals for the children, their breakfast, their packed lunches, or lunch here on a Sunday, and then their evening meal, plus snacks when they come in from school at about 5:30, 5:45. Back downstairs now in the communal area, bearing in mind it's Sunday morning. They're having some fun and doing the things that they enjoy doing. We've got 2 girls here who are spinning themselves around until I guess they'll be so dizzy they'll probably fall over. But lots of smiles, they never stop smiling. And when you It is of course really important for Arwind to have the remaining surgery done on the soft palate at the back, because surgery will be done at the GSR hospital as it has been done with all the other children here at the Cleft School project, and of course it's done entirely free of charge. I think that could be called the smile that would melt 1,000 hearts.